we are going to talk about causes of dizziness. So when a patient comes to you complaining of dizziness, first you have to know what exactly he means by dizziness. Does he mean vertigo, or what we call lightheadedness, pre-syncope or syncope, or is it postural instability and imbalance? So causes of vertigo are central and peripheral. The central causes are from the brainstem, like ischemia, bleeding, multiple sclerosis, tumors, and drug toxicities like alcohol, barbiturates, and phenytoin can cause central vertigo. Other causes are like basilar artery migraine and temporal lobe epilepsy. Peripheral causes are from the vestibular nerve and the labyrinth. And things that affect the vestibular nerve like herpes zoster, acoustic neuroma, ototoxic drugs like streptomycin, kanamycin, gentamicin, phenytoin, salicylates, loop diuretics can cause vertigo. From the labyrinth, acute labyrinthitis, benign positional vertigo, Meniere, trauma, labyrinthine fistula can cause also peripheral vertigo. Other causes of peripheral vertigo are acute and chronic otitis media and cholesteatoma. These are the central and peripheral causes. And other causes of vertigo can be neck problems and depression and anxiety. Causes of what we call lightheadedness, pre-syncope and syncope can be from the heart, from the vascular system, neurological system, metabolic, drugs, psychiatric, and musculoskeletal system. So, any arrhythmia in the heart, congestive heart failure, valvular disease, outflow obstruction like in aortic stenosis, hypertrophic cardio-obstructive myopathy, pulmonary stenosis, pulmonary embolism, and myocardial infarction can cause lightheadedness and dizziness. Vascular causes, we can classify them into postural hypotension and vasovagal. Causes of postural hypotension are hypovolemia, autonomic neuropathy, like in diabetes mellitus, antihypertensive medications like centrally acting drugs, and viral infections. And causes of vasovagal, what we call vasovagal attack, are carotid sinus hypersensitivity, prolonged standing, micturition, cough, and any painful or stressful stimuli like venipuncture can cause also dizziness. Neurological causes are like stroke, transient ischemic attack, migraine, epilepsy, head injury. Metabolic causes like anemia, diabetes mellitus, thyroid disease, hypoxia, electrolyte imbalance, hypoglycemia. Drugs, from the drugs, like drug side effects, illicit drugs, alcohol abuse, polypharmacy causing drug interactions, and herbals can cause dizziness too. Psychiatric causes like anxiety, depression, panic, hyperventilation, somatoform disorders also can cause dizziness. And musculoskeletal problems like cervical spine disease can also cause dizziness. If the problem is imbalance and postural instability, then the causes are cerebellar and sensory. So cerebellar causes like vascular causes, infection, inflammation, of course, in the cerebellum, trauma, tumor, metabolic, congenital, degenerative disorders, hereditary and storage disease, and we are going to talk about them later, can cause imbalance, and the patient may say it as dizziness. Sensory causes are from the vision, from peripheral proprioception, and muscle weakness and deconditioning. So any refractive changes, cataract, post-cataract surgery, diabetic retinopathy can cause imbalance. Multiple sensory deficits, peripheral neuropathy, B12 deficiency, diabetes mellitus can cause a problem in the peripheral proprioception and imbalance. We have a fourth category, which we call non-specific. It's when the dizziness is difficult to define, and it's non-classifiable in any of these categories, and it's mostly due to depression and anxiety. So here is a look at the general causes of what we call dizziness, and we are going to talk later about approach to a patient coming with dizziness.